Hello, everyone. Good evening, and thanks for joining us today and a very warm welcome to the fifth webinar on our brand new practitioner series. Today's topic is all about ADHD and nutrition and what can we do about it. My name's Ella, and I'm the practitioner lead at DR.VEGAN. We also have with us today our very special guest, Chapman, who's a nutritional therapist specialising in ADHD. Now, before we start, I quickly wanted to mention that our practitioner webinars are intended only for professionals. This includes trainee nutritionists, nutritional therapy practitioners, dietitians, naturopaths, and pharmacists. They're not intended for members of the public. Okay, so to start, I want to give you a very brief introduction to myself and Dana. So firstly, I have a passion for practitioner education and have previously worked in a lecturing and clinical supervisor role at one of the major nutritional therapy training institutes. I've since put my passion for education into training practitioners at DR.VEGAN and creating materials to make clinics much more efficient and easier for you. We also have with us today our very special guest, Dana Chapman. Dana, do you want to tell us a little bit about yourself and a bit about what you do?
Fab. Thank you so much, Ella, and thank you so much for having me on. As you mentioned, I am a nutritional therapist as well. I've been practicing for about 4 years now and specialised in ADHD about 18 months ago, when I really saw that there was a need for more information around what we can do nutritionally to help support people with ADHD. I am a member of BANT and I volunteer on their events team as well. So I have that clear, very close link with the BANT team who regulates and governs nutritional therapy in the UK. And that's a little bit about me.
Perfect. Now, before we start, I wanted to add, please do feel free to ask any questions that you have along the way. We are actually going to have a question and answer session at the end where we will be answering your questions. We will probably only have time to go through a few questions at the end. So if yours doesn't get answered, or if there's a question you feel you're not comfortable asking on here, then please do reach out to myself and I'll be able to help you. I'll be sharing my email address at the end, and also Dana will be sharing her details as well. So without further ado, let's get started. Okay, so today we're going to be discussing everything ADHD. So that includes statistics, what is dopamine and serotonin, blood sugar balance, dopamine and brain function, the physiology of ADHD, current treatment options, a nutrition approach to ADHD and what that looks like, an introduction to our brain fuel supplement, and time for discussion and questions. Okay, so let's get started. Around 5% of children and 3 to 4% of adults suffer from ADHD. That's 708,000 children and 1.9 million adults across the UK alone. That's a substantial number of people. And I would imagine that many of you have seen ADHD people or children with suspected ADHD in your clinic. Childhood diagnosis rates have increased from 1.4% in boys in the year 2000 to 3.5% in boys in the year 2018. And medication prescribing also rose from 0.6% to 2.4% in that same group. So there is a huge increase in the amount of children that are being diagnosed with ADHD and also in medication use as well for those people. Over 40% of adults report waiting over 2 years for mental health assessments relating to ADHD. That's a considerable amount of time when you don't know what's going on. You probably think you've got something like ADHD, or maybe it could be something else, but you're kind of in limbo because you don't really know what's going on because the waiting lists are so substantial. There's a very high prevalence of ADHD, yet a substantial underdiagnosis, and rising recognition, especially among adults and females, is becoming more common. And systemic bottlenecks occur along the way, as very long wait times as well, which can vary across regions. So sometimes it's a postcode lottery, and also there's a delay to access for the treatment. And diagnosis and assessments and assistance with people that do have ADHD. Okay, so serotonin. So what is serotonin? Serotonin, or 5-hydroxytryptamine, also shortened to 5-HT, is a monoamine neurotransmitter synthesized from the essential amino acid tryptophan. It acts as a key signaling molecule in both the central nervous system and the peripheral nervous system, and functions as a neuromodulator, hormone, and paracrine signal. While serotonin is widely recognized for its role in mood regulation, it is also crucial for functions such as appetite, sleep, digestion, and thermoregulation, pain perception, and vascular tone. Okay, so why is serotonin so important? It's important for many, many reasons. And it plays a vital role in a wide range of physiological and psychological processes. So, for example, mood and emotional regulation. So, serotonin influences feelings of well-being, calmness, and happiness, and imbalances or linked to depression, anxiety, and mood disorders. It's also involved in the sleep and wake cycle, so it helps to regulate circadian rhythms and is a precursor to melatonin, the hormone that governs sleep. And then we also have appetite and satiety. So serotonin in the hypothalamus and gut modulates the hunger and food intake. And it also works on cognition and memory. So it affects learning, attention, decision making, particularly in the prefrontal cortex. It affects gut motility and secretion. About 90 to 95% of the body's serotonin in the gastrointestinal tract, where it regulates intestinal movements and secretions. It is also involved in pain perception as well. So serotonin modulates the nociception and is involved in the central pain inhibition. And it's also related to cardiovascular health and vascular function. So serotonin can cause vasoconstriction or vasodilation, depending on the receptor subtype and location. Okay, so where is serotonin created and how does it enter the brain? So there's central serotonin synthesis in the brain, and it's synthesized by serotogenic neurons, mainly located in the RAF nuclei, the brain stem, so especially in the dorsal RAF nucleus. Serotonin is produced from tryptophan through 2 key enzymatic steps. That's tryptophan hydroxylase in the brain, and we've also got aromatic L-amino acid decarboxylase. Serotogenic neurons project widely throughout the brain, including the limbic system, the prefrontal cortex, the thalamus, and the hypothalamus, influencing diverse neurocircuits. Most serotonin is made from enterochromaffin cells in the gut mucosa. It also circulates in the blood, mostly stored in platelets, and plays various roles in vasoconstriction, platelet aggregation, and also in gut motility. So although we normally think of it as the happy hormone, it is so much more involved in basically a very large amount of biological processes. So the brain does actually synthesize its own supply of serotonin from tryptophan, which can cross the blood-brain barrier by a large neutral amino acid transporter. So that the tryptophan is actively transported across the brain for the purpose of creating serotonin. And brain serotonin production is influenced by tryptophan availability, which is affected, of course, by diet. You have to be eating enough tryptophan, insulin, and competition with other amino acids as well. So not only do we need that tryptophan to make the serotonin in the brain, there's also this influence of everything else that's going on, such as blood sugar balance, what else we're eating. Okay, so what is dopamine? Sorry, I skipped ahead a bit there. Okay, so dopamine is a catecholamine neurotransmitter and neurohormone synthesized from the amino acid tyrosine. It functions as a key signaling molecule in the central nervous system and peripheral nervous system. It's involved in the movement, motivation, reward, attention, hormone regulation, and many more pathways within the body. Dopamine also acts as a precursor to noradrenaline and adrenaline in the catecholamine synthesis pathway. So why is dopamine so important? And the answer is simple, because dopamine is essential for several critical physiological and psychological processes. So motor control is one of them. So degeneration of dopaminergic neurons in the substantia nigra leads to Parkinson's disease. As we all know, that is an issue with dopamine. And it's also needed for reward and motivation. So dopamine activity in the mesolimbic pathway underlies reinforcement, learning, goal-directed behavior, and addiction. And also needed for mood and cognition as well, because dopamine is another feel-good hormone. So dopamine modulates attention, memory, and executive function, and imbalances are implicated in ADHD, depression, and also in schizophrenia. Now, obviously, today we're going to be focusing on ADHD, but we also have to think about everything else that dopamine and serotonin are involved in. So dopamine is also needed for the endocrine function. So dopamine inhibits prolactin secretion via the tuberine-fungular pathway. And it's also needed for the autonomic and cardiovascular function. So dopamine has various peripheral effects, including vasodilation and modulation of renal blood flow. Okay, so central dopamine synthesis occurs in the brain, and it's synthesized by dopaminergic neurons. And these dopaminergic nuclei are called the substantia nigra, and these control the nigrostatial pathway. And then we've got the ventral tegmental area, and that's the reward and the motivation, and that works via the mesolimbic and mesocortical pathways within the brain. So it works in the brain in several areas to affect executive function and all these things that we've just talked about. And dopamine is synthesized from L-tyrosine into L-dopa and then into dopamine, and that's through two key enzymes. And those enzymes are tyrosine hydroxylase and also dopa decarboxylase. Okay, so peripheral dopamine, interestingly, is also produced in the gut, the kidneys, the adrenal glands, and the sympathetic nerves, where it acts locally to have effects all over the body. And the brain relies on precursors like tyrosine and L-dopa, which can cross the blood-brain barrier to synthesize dopamine internally in the brain. So it's synthesized in the brain from L-dopa for its effects on things like attention, learning, executive function, and also synthesized in other organs of the body for its other functioning and the way that it affects those systems. Okay, so let's have a look at the dopamine cycle. Okay, so we've got tyrosine, which is converted into levodopa in the gut by tyrosine hydroxylase. And L-dopa can cross the blood-brain barrier, and once inside the brain, L-dopa is converted into dopamine by dopa decarboxylase. And then the probiotics can influence the tyrosine hydroxylase activity. So you have to have good gut health to have good dopamine synthesis. And if you have an imbalance in your dopamine synthesis, you might have disordered eating, which can cause bad gut health, that creates this vicious cycle. Or alternatively, you have good amounts of dopamine or a healthy balance of dopamine. You may have a more balanced diet and have less impulses for junk food or sugary foods, and therefore you're more likely to have a healthy gut, which promotes the growth of beneficial bacteria, which then promotes the synthesis of L-dopa in the gut, which then goes to the brain. So it is a bit of a cycle there, and sometimes there is an imbalance in that cycle, and you just have to work out where to start. Okay, so let's have a look at blood sugar balance, because this is quite often underlooked when we're looking at dopamine. Okay, so dopamine synthesis actually depends on stable blood glucose levels, as glucose is the brain's primary energy source and the brain's preferred energy source. So stable blood sugar is essential for optimum dopamine production. The synthesis of dopamine and tyrosine is also dependent on ATP, and having a hyperglycemic state reduces neuroactivity and availability. Hyperglycemia can impair the activity of tyrosine hydroxylase, the rate-limiting enzyme in dopamine synthesis, which can then cause a problem. And chronically low and unstable blood sugar may lead to reduced dopamine levels, contributing to fatigue, low motivation, poor focus, and depressive symptoms. And high blood sugar spikes may also lead to short-term dopamine surges. High glycemic foods can increase dopamine synthesis temporarily within the brain. Sugar and refined carbohydrates rapidly release insulin into blood glucose, triggering the dopaminergic response, especially in the nucleus accumbens, which is the reward center of the brain. And this is similar to how addictive substances stimulate the mesolimbic dopaminergic pathway, resulting in cravings and reward cycle. However, repeated spikes of blood sugar can lead to dopamine receptor downregulation, blunted reward sensitivity, and poor impulse control seen in binge eating and addiction-like behavior, and as well as mood dysregulation. Insulin resistance may also impair brain dopamine signaling, and emerging evidence actually shows that insulin receptors in the brain help regulate dopamine transport and signaling. In insulin resistance, dopamine transporter functions may be altered, leading to dysregulated dopamine clearance from a synapses. And this has been linked to impaired executive function, anhedonia, and attention deficits, which are relevant conditions to ADHD, depression, and obesity. Now, I'm going to actually hand over to Dana, who has some very exciting nuggets of information for us. And just to remind you, as we mentioned at the beginning, Dana is a nutritional therapist who specializes in ADHD. So listen up, everyone, because I'm sure you're going to learn some very useful information today.
Thank you so much, Ella. So I'm going to take you through the physiology of ADHD and then the 3 key areas that I really focus on, which is building on what Ella has said now already. So physiologically, in the past, we used to believe that ADHD was an imbalance or a lack of dopamine. We now know that ADHD is a lot more complicated than that. The etiology and pathophysiology of ADHD is quite complex, and we don't really understand it in its entirety. But what we do know is ADHD is as a result of an alteration of any one or more of the catecholinergic factors, dopamine, adrenaline, and noradrenaline. But we also now know that serotonin plays a really big role, and the glutamate and GABA pathways play a role in ADHD as well. So it's not simply a lack of dopamine. We need to be looking a lot further than dopamine. And I'm going to show you in a minute a diagram that shows these pathways, where we've got the serotonin melatonin pathway, the dopamine, noradrenaline and adrenaline pathway, and the GABA and glutamate pathway. We need to be looking at all 3 of those in helping somebody with ADHD and helping support them nutritionally and physiologically. So I think I've covered everything in that slide. If we can move on. Thanks.
Yeah, of course.
So Ella's already spoken about dopamine and serotonin, but in terms of ADHD, this gives you a little bit more information as to exactly how these neurotransmitters relate specifically to ADHD. You will hear a lot of people on TikTok and social media saying that the first time that they took ADHD meds, it felt like somebody had turned that volume down in their brain. And that's exactly what dopamine does, is it helps reduce that noise. An ADHD brain is very, very busy. It's very noisy, 1,000 ideas coming per second. And dopamine really helps reduce that noise. We know that it's important as well for it's our motivation and our motivation reward center. Dopamine is actually released in the anticipation of reward rather than being released when we do get that reward. Dopamine and sugar have a very close relationship. Simply the presence of sugar in your stomach causes your brain to release dopamine. So that again is one of the links between why somebody with ADHD may be craving this sugar or always going back to it. Noradrenaline is one of the other catecholamines or neurotransmitters. And noradrenaline really helps enhance the signals that we need for that alertness, attention, and learning. Serotonin helps us feel safe. It was explained to me by somebody very important, that serotonin is a nice homecoming. It helps you feel safe. That feeling of when you get home and you know it's all safe and cozy, that's your serotonin. It helps also regulate impulsivity and hyperactivity, which is what Ella mentioned earlier. And then we're thinking about acetylcholine. So that's not one, it's not a catecholamine, or it's not a neurotransmitter that we often think about, but acetylcholine is also important in learning and memory. And then GABA and glutamate or glutamine. GABA is our main off switch. It's our anti-anxiety neurotransmitter. And glutamate is our main excitatory. So the naughty boy who gets diagnosed with ADHD is often a lot more glutamate rather than GABA. And we make it on the same pathway. And if there's blockages between making your glutamine and making your GABA, that can be a reason why somebody is feeling very excitatory. Glutamine and glutamate and GABA, and actually all of our catecholamines have a life cycle. So glutamine and glutamate is similar to cortisol. We have a lot of it in the morning. It's our get up and go. It's our on switch, whereas GABA is our off switch. It helps us relax. It helps us fall asleep. And I always get disturbed, so excuse me. I'm so sorry about that.
No worries. It happens to us all day now.
If we can go on to the next slide, please. Yeah, if you have boys, they never go to dad, they always go to mum. And it's not the first presentation that this has happened to, so apologies, everyone.
Fine, don't worry.
So I love showing this diagram. This is an image which has come from, I don't know if anyone is familiar with LifeCode GX. They are a genetic testing company, and they really zone in on genetics within a specific pathway. And so this image comes from their neurotransmitter genetic test. And why I like to show it is because it very clearly illustrates how you're actually making your neurotransmitters. So like we've mentioned, serotonin is made from tryptophan. We make melatonin from serotonin. Dopamine is made from tyrosine, and you can see how we've got the tyrosine, L-dopa, dopamine, and then we get our noradrenaline and adrenaline from there. And why I love showing this is you can clearly see the cofactors within these transactions, within these conversions within the body. And you can very clearly start to see what nutrients are very important when it comes to ADHD and supporting any clients or yourself if you have ADHD. Supporting your clients with these nutrients, because there may be genetic blockages, which means that that person could really benefit from more nutrients in a certain way. So if we can just flick on to the next slide, please. I wanted to give a quick overview of how medication actually works so that we can also illustrate the use of nutrition and nutritional therapy in ADHD. So the pharmacological treatment is methylphenidate, which is the first line of therapy. And methylphenidate works by blocking the reuptake of dopamine and noradrenaline. So it works on that dopamine noradrenaline pathway. And how neurotransmitters work is they're released from that presynaptic cleft. They have to release from the vesicle. They pass that presynaptic cleft, and they are accepted by receptors on the receptor sites. So medication is blocking the reuptake because we release our neurotransmitters, but then they are also retaken up into the cell if they are not accepted by those receptors. So methylphenidate works by blocking the reuptake of both dopamine and noradrenaline, which means that it has longer within that synaptic cleft, which means that there's longer for those receptor sites to actually accept that dopamine and noradrenaline. Dexamphetamine works by blocking the DAT reuptake transporters, but it also increases the release of dopamine. And cocaine has the same effect, but a much more heightened effect. But dexamphetamine, what it does is it not only blocks the reuptake of that dopamine, it also causes you to release more dopamine. And then we've got non-stimulant medication, atomoxetine, and that is a norepinephrine reuptake inhibitor. So norepinephrine, noradrenaline are the same thing. Noradrenaline obviously is used a lot more in the UK, whereas norepinephrine is used a lot more in the United States. So medication works for some people, and I think if you're seeing clients with ADHD, it shouldn't be a question of medication or nutrition. It should always be a case of medication and nutrition. How can nutrition help enhance how the medication is working? But also, how can nutrition be a scaffolding? And medication then only needs to be used as and when. So, for example, if you're supporting children, maybe then they would only need to take medication on those school days, because we know that medication has a number of side effects. So the current known side effects of ADHD medication can be anything from stomach upset to headaches to aggression, constipation, so a lot of gut-related symptoms. And we already know from what Ella said that gut health is so important when it comes to ADHD, that yet a lot of these medications can be upsetting the balance of the gut and the gut microbiome. We also know, or what people aren't actually aware of, is that ADHD medication can impact somebody's health and wellness in the long term. So that last point there, those who took ADHD medications for 3 to 5 years and more than 5 years had a 65% increased risk and a 49% increased risk of arterial disease. So heart disease and heart can be a factor, and that's why a lot of people with ADHD will then use blood pressure checkers to check their blood pressure as they're taking their medication. And efficacy remains a matter of debate. If you start speaking or being in the field of ADHD, you will hear a number of people saying they took the medication but absolutely didn't agree with them. So that efficacy still remains a matter of debate, and it's because potentially they only work on the dopamine noradrenaline pathway. They may have an impact on the serotonin pathway, but they don't have an impact, to my knowledge, on the GABA and glutamate pathway. And we know that the physiology of ADHD, we need to be looking at all of those neurotransmitter panels, all the sections within those neurotransmitter panels. If we can go to the next slide, please. So there is no cure, obviously, for ADHD, and no nutrition professional should be saying that they can cure anyone. But what we can do is help manage the symptoms of ADHD. We can help manage or improve memory, focus, energy, and concentration. We can help decrease brain fog. We can help improve executive function, quality of sleep, and we can reduce coexisting symptoms, because often with ADHD comes disordered eating, and that can bring a whole host of health conditions with it. We can improve quality of life, improve energy, and we can help balance hormones, which is going to help somebody feel better about themselves and hopefully then look after themselves more and have the motivation to do that as well. If we can flick to the next slide, please. So I focus on 3 specific elements when it comes to nutrition for ADHD. The first one is we know that neurotransmitters, or those catecholamines, are important in ADHD, and it's understanding how these are made and what nutrients are actually needed. The second element is that neurotransmitters need to bind to their receptors effectively, and inflammation can really impact that process from happening. If we are inflamed, our receptors don't work as effectively, which means that the neurotransmitters cannot actually bind to their receptor site and become active. And then I focus on gut health. So we know that over 90% of serotonin is made in the gut. Over 50% of dopamine is made in the gut. GABA is made in the gut as well. And whilst we know that a lot of these don't actually cross the blood-brain barrier, they do still have an impact on how the brain actually functions. So genetics help us understand a little bit more about physiology. So I love to use genetic testing, but nutrition can successfully be used in managing all of the conditions and coexisting conditions, but these are still the 3 elements that I focus on, and I'll take you through a little bit more detail with regards to these 3 elements now. So when we're looking at the first element, the nutrients that are needed for our neurotransmitters, we've already spoken about tyrosine and tryptophan, which are 2 key amino acids, which are really important because they are the starting blocks for us being able to make our dopamine and being able to make our serotonin. Then there are key nutrients, and that's why I love this genetic report so much, is because what you will see, the green and yellow and red dots are the genetic SNPs along the pathway. And the bits that you see in purple are what we call the cofactors. So those are the nutrients that are needed for that process to happen effectively. And then anything in orange helps slow that process down. So key nutrients when it comes to ADHD, B vitamins are absolutely essential. We make our neurotransmitters through a process called methylation, which I'm sure you are familiar with. And methylation, we know we need B vitamins and we need folate for that. So B vitamins are absolutely key. You will also see B6 in a number of the pathways. You see B6 here in the dopamine pathway. It is in the GABA glutamate pathway, and it is in the serotonin pathway as well. So B6, absolutely key. Zinc is a very key nutrient. We need zinc for good brain health and brain function. Magnesium is used as a cofactor for a number of these processes. Iron is one of the most abundant nutrients in the brain, so absolutely vital for helping us make our neurotransmitters, as is vitamin C and vitamin D. So we know vitamin D is important for mental health, but now we can start to see that it's really important when it comes to ADHD as well. We know that omega-3 is very important. Omega-3 is needed for brain structure. So the DHA part of omega-3 is needed for that brain structure, and the neuronal activity, we need EPA for that as well. What you don't see here is in the serotonin pathway, we do have what's called the tryptophan steal, where if there is inflammation or if there is an increase in stress, our body can shunt resources. Instead of using tryptophan to make serotonin, it can shunt resources down the chynurenic acid pathway, which is a more neurotoxic pathway. So we're really wanting to control any inflammation within the body, and that's where omega-3 becomes really important as well. A lot of the research in ADHD is on children, because we used to think that people grew out of ADHD. And a lot of the research has shown that supplementing with things like magnesium, iron, zinc, and copper and selenium has shown to ease the symptoms of ADHD. And the research isn't quite clear as to why people respond, because some research papers showed that it was children that were deficient in those nutrients had a much better improvement in their symptoms, but that was debunked in other papers. So Felice Jacka is a really good researcher in this area. Is it Felice Jacka, or am I getting confused with somebody else? But there is research to show that it's difficult to know who's going to respond or not. But what we do know is generally people with ADHD respond well to supplements such as magnesium, iron, zinc, copper, and selenium. A lot of research in children actually showed that children with ADHD had low iron and low zinc levels, as well as low magnesium. So we know that zinc is important for sense of smell and taste. And are the children with ADHD food sensitive because they are low in zinc? And are they low in zinc because they are food sensitive and not eating those foods high in zinc can really be a vicious cycle. So I find that zinc is one of the key nutrients to really focus on and to supplement and to get things like those nuts and seeds into the diet where possible. Can we flip to the next slide, please? I think we can go to the next one as well. So we can focus on macronutrients and we can focus on micronutrients. So in terms of protein, making sure that each meal and snack has got a good source of protein in it, using things like eggs, yogurt, cheese, beans, lentils, nuts and seeds, fish, particularly oily fish because of that omega-3 content, poultry and red meat. And the reason why nutritionists are amazing is because things like nuts and seeds, oily fish have got all of the nutrients that I have spoken about. So they've got the B vitamins, they have got zinc, they have got iron. So really, really key to be getting in these whole foods into somebody with ADHD and helping support them in that way. Fat is also important in terms of helping balance blood glucose levels, but also helping feed that brain. And again, things like oily fish, avocado, nuts and seeds, full-fat Greek yogurt, olive oil are all going to be supportive in the diet of somebody who has ADHD. And then next, I think we've just clicked next, we go to the micronutrients. So we've spoken about magnesium being important, which is high in things like nuts and seeds and your green leafy vegetables, vitamin B6 in animal protein, beans and lentils, nuts and seeds, zinc, again, fish, red meat, poultry, nuts and seeds. And again, I think I've just mentioned that the amazing thing about eating sources of protein is you get these lovely micronutrients with it. Vitamin C is a slight outlier to the other ones, which you can get from, I love thinking about red and purple when I think about vitamin C. So strawberries, kiwi fruit, blueberries, red peppers, tomatoes. I would add pomegranates in there just because they're amazing for gut and gut health. Next slide, please. So the role of the gut in ADHD. We know that the gut microbiome can modulate brain development, function, and behavior by a number of pathways. So via the immune pathway, via the hormonal pathways, or neuronal pathways. And that's all done via this gut-brain or microbiota gut-brain axis. Research into the gut microbiome and its direct impact on the development of ADHD is still in its infancy. But research is beginning to highlight that individuals with ADHD often have a reduced gut microbiome diversity, and that is correlated with ADHD prevalence, but also worsening of ADHD symptoms. We also know that the gut microbiome and imbalances in that gut microbiome occurs in various other neurological disorders. So things like Alzheimer's disease, Parkinson's disease, autism spectrum disorder, epilepsy, and major depressive disorder. The research in those areas is quite mature, and we can very clearly see the links between the role of this gut microbiome and these mental health conditions. So the research is beginning to really expand and bloom in the area of ADHD, which is really exciting. We know specifically that certain bacteria have been identified as being able to produce dopamine in the gut. And if they're producing dopamine in the gut, they then may also be producing that L-DOPA, which we know can cross the blood-brain barrier. So the specific species of bacteria there are the bacilli, the E. coli, Proteus vulgaris, Serratia, and the Staphylococcus ones, as well as Hafnia alveoli and Klebsiella. So a number of species of bacteria there may be able to help support somebody with ADHD in terms of making that dopamine within the gut and potentially that L-DOPA that crosses the blood-brain barrier. The development and integrity of the gut barrier and the blood-brain barrier are dependent on the gut microbiome. And this is another reason why I like to focus on gut health when it comes to ADHD, because a leaky gut barrier can lead to neuroinflammation. And we know that neuroinflammation can result in worsening of ADHD symptoms. So remember I said when you're inflamed, those neurotransmitters cannot bind to their receptor effectively. And gut dysbiosis in general can also be a driver of that neuroinflammation. And so inflammation is the third element that I often look at when it comes to ADHD and supporting people with ADHD. And if you can just flick to the next slide, please. So we know that there is a co-occurrence of ADHD and a lot of inflammatory disorders. And we see that in a number of people with ADHD. They've got these added inflammatory conditions, such as things like asthma, allergic rhinitis, dermatitis, and allergic conjunctivitis as well. And what we can see is that the upregulation of these inflammatory molecules can have an impact on neurotransmitters. So that's what I was saying, is those neurotransmitters, the way that they are made can be impacted by inflammation, but also if we are making them, they don't bind as effectively to the receptors. And we know that there is evidence now indicating that neuroinflammation is a possible factor in ADHD, but we know that nutrition is a way that we can support both inflammation and neuroinflammation. I think we're going on to the...
Yes. Thank you so much, Dana. That was very, very interesting and informative. And I certainly learnt a lot, and I'm sure our audience also have learnt a lot as well. So thank you very much for that.
My pleasure.
Okay, so now before I move on and talk about some of the research, I wanted to quickly introduce you to one of Dr. Vegan's supplements, and that is Brain Fuel. Now, Brain Fuel is actually an award-winning supplement with proven botanicals, vitamins and minerals, including bacopamide, which is a patented form of bacopa, phosphatidylserine, ginkgo biloba, and many others to improve memory, recall, focus, and cognitive performance. Brain Fuel focuses on your attention and supports your concentration, energy, and mood. And as you can see here on the right side, we've got a whole list of ingredients which are really, really beneficial. And some of them Dana has already spoken about in depth today. So I'm going to go through some of the research on those now. Okay, so bacopamide is Bacopa minori extract. And it's been traditionally used in Ayurvedic medicine to enhance cognitive function. The extract has been shown to improve attention, cognitive processing, and working memory in healthy elderly individuals by supporting cognitive processing and working memory in adults, and suppressing acetylcholine activity. Acetylcholinesterase is the enzyme that breaks down the neurotransmitter acetylcholine, which plays a crucial role in memory and learning. By inhibiting acetylcholinesterase, Bacopa minori extract increases acetylcholine levels, improving cognitive function. A meta-analysis of randomized controlled trials found that bacopamide has potential to improve cognition, particularly the speed of attention. This analysis included 9 studies with 518 subjects and found that Bacopa minori improved cognitive function as measured by the Child-Beat test and choice reaction time. A randomized double-blind placebo-controlled trial also found that Bacopa minori improved attention, cognitive processing, and working memory in healthy elderly subjects. And the study used standardized extract of Bacopa minori and found that it suppressed acetylcholinesterase activity, which may also contribute to its cognitive enhancing effects. Now, Bacopa contains steroidal known as bacosides, and an open label study found that Bacopa produced a significant reduction in restlessness. That was by 93%. Improved self-control, that was by 89%, and attention deficit symptoms by 85% in individuals with ADHD. So it's a significant piece of research for those who want to work with patients with ADHD or those who have ADHD themselves. And we've got ginkgo biloba extract in here, which has also been used for centuries to improve cognitive function and memory. The extract contains flavonoids and terpenoids, which have an antioxidant and anti-inflammatory effect. Ginkgo biloba has been shown to improve cognitive function in individuals with mild cognitive impairment, possibly by reducing oxidative stress and inflammation in the brain. And additionally, the extract may improve blood flow to the brain, leading to enhanced cognitive function. Several clinical trials have investigated the effects of ginkgo biloba on brain health and cognition, and a randomized double-blind placebo-controlled trial found that ginkgo biloba improved cognitive function in patients with dementia of Alzheimer's type. And another study found that ginkgo biloba enhanced cognitive function in patients with mild cognitive impairment. Ginkgo biloba contains terpenoids called ginkgolides. And in an open label trial, children with ADHD who were intolerant or unresponsive to ADHD medication were given ginkgo biloba. And the parents noticed an improvement in cognitive performance and in their quality of life. So again, that's a really good study for your clients. Okay, so we've got phosphatidylcholine. Now, phosphatidylcholine is a phospholipid that plays a crucial role in neuron membrane structure and function. So the nutrient has been shown to improve cognitive function in older adults, possibly by reducing cognitive decline and improving memory. Phosphatidylserine may also have neuroprotective effects and reduce the risk of age-related cognitive decline and dementia. And a meta-analysis of clinical trials on phosphatidylserine and brain function found that the nutrient improved cognitive function in older adults, particularly in the areas of memory and executive function. Phosphatidylserine is a phospholipid found in high concentrations in the brain and supports integrity, as mentioned earlier, and is very important for cognitive function. And children with ADHD that were given phosphatidylserine for 2 months in a randomized double-blind control trial found a significant improvement in overall ADHD symptoms, attention deficit and hyperactivity and impulsivity, as well as short-term auditory memory and go and no-go task performance. Okay, let's have a look at some of the B vitamins. So the first B vitamin that I want to look at here is vitamin B1, so also known as thiamine. It is essential for energy production in the brain, as we all know, and a deficiency can lead to impaired cognitive function, including memory loss and confusion. The vitamin plays a crucial role in the synthesis of neurotransmitters such as acetylcholine, and it's also involved in the maintenance of healthy neuron membranes. A meta-analysis found that thiamine supplementation improved cognitive function in patients with mild cognitive impairment and also in Alzheimer's disease. And thiamine is also involved in producing acetylcholine and GABA, which are neurotransmitters essential for mood regulation, learning, and focus. And thiamine supports healthy nervous system, maintaining nerve signal transmission necessary for cognitive function and concentration. So Dana talked about acetylcholine and GABA earlier and how that relates to ADHD. So again, this is a really important nutrient for your clients. Okay, so vitamin B3, commonly known as niacin. So that's also involved in energy production, much like thiamine. And it has a high amount of antioxidant properties within the body as well. So niacin deficiency can lead to impaired cognitive function, including memory loss, confusion, and it also has neuroprotective effects on the brain, and it reduces the risk of age-related decline and dementia. And a meta-analysis found that thiamine supplementation improved cognitive function in patients with mild cognitive impairment and Alzheimer's disease. And several clinical trials have found the effects of niacin on cognitive performance to increase cognitive performance basically in humans. And one study found that niacin supplementation improved cognitive function in patients with mild cognitive impairment, and another study found it had a significant effect on cognitive function of healthy older adults as well. So it has a positive effect on those with cognitive impairment and those without cognitive impairment. And vitamin B3 is also essential for producing NAD+ and NADP+, which are, of course, coenzymes that help generate energy within the brain, and they're essential for synthesizing neurotransmitters like serotonin, dopamine, noradrenaline, and all those involved in mood regulation, focus, and alertness. Okay, vitamin B5, pantothenic acid. So again, another one that's essential for energy production, particularly energy production in the brain, and also the synthesis of neurotransmitters. Actually, it's pretty crucial in maintaining healthy neurons and healthy membranes, and in the production of neurotransmitters. So it's really needed for proper brain function. And also it's been shown to be helpful in neurodegenerative diseases as well. So this is a good one to add in. A meta-analysis of clinical trials found that vitamin B5 was really useful for brain health, and it had a positive effect on cognitive function in patients with mild cognitive impairment and Alzheimer's. And another meta-analysis found that vitamin B5 supplementation improved cognitive function in healthy elderly adults. So again, another nutrient that is beneficial for those with cognitive impairment and also those without cognitive impairment. So several clinical trials have investigated the effect of vitamin B5 on brain function and cognition. And a randomized double-blind placebo-controlled trial found that vitamin B5 supplementation improved cognitive function in patients with mild cognitive impairment. And of course, vitamin B5 is essential for making coenzyme Qa, which is vital in energy metabolism and helps to convert carbohydrates, fats, and proteins into energy that the brain cells need for optimal functioning. So coenzyme A is also involved in the production of acetylcholine, a key neurotransmitter important for memory, attention, and learning. Okay, so vitamin B6, a really interesting one. Dana touched on this earlier. So again, vitamin B6 is essential for neurotransmitter production, including serotonin and dopamine, and also is essential for maintaining healthy neuromembranes. The vitamin has been shown to improve cognitive function in older adults and also reducing cognitive decline and improving memory in those individuals as well. So vitamin B6 has neuroprotective effects and reduces the risk of age-related decline and dementia. And because it balances hormones and neurotransmitters, it is really good to use with your ADHD clients. And studies conducted in those with childhood and adult ADHD show that vitamin B6 levels are consistently low in those individuals. So obviously, if there's any nutrient deficiencies or suboptimal levels, we need to correct those. But it's really nice to see studies that show it's therapeutic as well on people without deficiency and with deficiency as well. Okay, then we've got vitamin B12, again needed for the synthesis of neurotransmitters and for healthy neuromembranes. And deficiency can lead to impaired cognitive function, including memory loss and confusion. And it also has neuroprotective effects and reduces the risk of age-related cognitive decline and dementia. And a meta-analysis of clinical trials on vitamin B12 and the brain have found that vitamin B12 had a positive effect on cognition and was beneficial even to those with Alzheimer's disease. And another meta-analysis found that B12 supplementation improved cognitive function in healthy elderly adults. And several clinical trials have also investigated the effects of B12 on brain function and cognition in general, and found it to be really beneficial on the population as a whole. So again, looking at those people that have Alzheimer's, dementia, or cognitive impairments, ADHD, but also in healthy populations as well, it was really supportive of brain function. And of course, B12, we know it plays a role in the speed of communication between cells. And a meta-analysis looking at the nutrient status of children with ADHD found consistently low levels of vitamin B12. And lower B12 levels is associated with more severe ADHD and poorer memory scores. So it's really important to make sure you've got enough B12 going into your diet. And if you are following, or your clients following a plant-based diet, it's really essential to get that daily supplementation in there. Okay, so we've also got turmeric. This is one of my favorite ones. It's basically useful for everything. Turmeric contains curcumin, as we know, so that's a polyphenolic compound and is highly anti-inflammatory. It's been shown to improve cognition function in adults and especially in individuals with neurodegenerative diseases. And it works by reducing oxidative stress and inflammation in the brain. It's also neuroprotective and it reduces the risk of age-related decline and dementia. And a meta-analysis of clinical trials on turmeric and brain health found that the spice had a positive effect on cognitive function in patients with mild cognitive impairment and in Alzheimer's disease. And another meta-analysis found that turmeric supplementation improved cognitive function in healthy adults. And several clinical trials have investigated the effects of turmeric on brain function and cognition. And another randomized double-blind placebo-controlled trial found that turmeric supplementation improved cognitive function in patients with mild to moderate cognitive impairment. Okay, so the active compound in curcumin inhibits cyclooxygenase pathway, especially COX-2, and reduces prostaglandin production and inflammation. It also inhibits the lipooxygenase pathway to some extent, and that decreases the leukotriene synthesis. This reduction in inflammation is beneficial for general brain function and cognition, and there are several ongoing trials to add curcumin to those with ADHD to see what happens. Okay, so we've got zinc in here as well as the final nutrients. And of course, that's an essential tracer mineral that is needed for neurofunction and synaptic plasticity. So a deficiency in zinc can lead to impaired cognitive function, including memory loss and confusion. The mineral may also have a neuroprotective effect, reducing the risk of age-related decline and dementia. And a randomized double-blind placebo control found that zinc supplementation improved cognitive function in patients with mild cognitive impairment. And so zinc helps with neurotransmitter regulation, neuroplasticity, and synaptic function. And it has antioxidant properties as well, and it's shown to moderately benefit those with ADHD. So a survey of zinc supplementation in children with ADHD found that zinc improved attention and reduced symptoms of ADHD. And as Dana mentioned earlier, so zinc is one of the minerals that can be quite low in children with ADHD. So it's really important to get that nutrient in there, and also for adults as well. So before we move on to the question and answer session, I also want to mention that we have our omega-3 supplements. That's algae oil, so that's also going to be really beneficial to those with ADHD. And we also have our Stay Calm supplement, which has got some really nice herbs in there and some nutrients in there to help reduce stress and just to bring everything down a notch. This can also be relevant to your clients who have ADHD that are maybe a little bit overwhelmed, overstressed, got too much going on, have trouble relaxing. So this is a really nice one for you to go and look at on our website. Okay, so here are the references. So you can go and have a look at those. And if you want me to drop you an email with the references in, I can also do that. Just let me know and I'll send that to you. Lots of references on there today. Okay, so we're going to have a Q&A session. So let me just have a look at the questions. Just bear with me. Okay. Okay, so we have one here. So Dana, if you want to support somebody with ADHD, where would you start?
Really good question. I think with ADHD, everybody is so unique, but I always do focus on those three elements. So trying to identify whether they have got any nutrient imbalances, supporting with diet first, and if somebody's got the money, the first place I would spend on testing would be a genetic test. That's just how I like to work. But if there's something going on in the gut as well, you wanting to test that gut and understand what's going on there, is that driving any neuroinflammation? So just keeping the three elements in mind, where can you start? What is most relevant for that person? What are their goals as well? And starting in that way. But I also do like to use nutrients and start them on something, because people with ADHD like to get something from their efforts. So if you can give them a quick win by supporting with the key nutrients that we spoke about today, that also may be a really good place to start.
Perfect. Thank you, Dana. Okay, so I have a question here. So can children take brain fuel? So brain fuel has been designed for adults. Whether children can take it or not, that would be up to your professional recommendation. So if they were like an older teenager or a teenager who's quite tall, then just use your professional judgment on that. For little children, again, it depends how much of the nutrition they need and the quantity that's in there versus what the child's getting elsewhere, getting in their diet. So I would say potentially yes, but you'd have to use your clinical judgment on that and look at what else they were taking alongside. And maybe you could give them half dose, but again, it depends on the age, it depends on their weight and height. So you just have to use your professional judgment on that and on that dosing. But yes, I would say if you dose it appropriately, but on the packet it says for adults, so just use your professional judgment on that. Okay, Dana, we have a question here. How can APOE4 carriers with ADHD get omega-3 in the brain?
My knowledge on APOE4 genes is not up to scratch, so I'm not a geneticist, but APOE4, especially in terms of risk of things like Alzheimer's disease and dementia, I think those theories have been disproven. So getting the omega-3 into the brain, I don't know if that is reliant on APOE4. Is that your understanding?
I'm also not up to date with that either, Dana. I can do some research though, absolutely, and find out for you. So yeah, I can absolutely do that. Do that research for you and let you know on email. Okay, so I have another question for me. Do you have a supplement suitable for children age 5? So again, with all of our supplements, they are designed for adults, but you have to use your professional judgment. So sometimes, the supplements are appropriate to open them up, and you could use a half a capsule or a third of a capsule, depending on the child's age, height, and weight. So for a 5-year-old, it may be that you think a third or a quarter of the brain fuel would be relevant. But again, you have to use your professional judgment on that. So our omega-3 oil, which is from algae oil, again, you can give them to children because if children need DHA and EPA, they need omega-3. But again, just make sure the child isn't going to choke on that. But yeah, there's no problem giving them the omega-3 there. And obviously we have, a lot of supplements, but again, it's just about using your clinical judgment and deciding whether, okay, so I'm going to open this capsule and give this child a third or a half or whatever you feel is relevant as a practitioner. Okay, and there's one more question, Dana, for you. How can you tell if someone is inflamed and what would you do about it?
Very good one. Inflammation is one of those things that people don't really feel, and you go according to symptoms. So people don't realize that they may be inflamed. So obviously you can use testing and things like CRP and high sensitivity CRP and ESR in bloods. But often you can go according to symptoms. So if ADHD symptoms are incredibly, off the charts and nothing really is helping, if somebody has got lots of brain fog, if somebody is really struggling with their mental health, those are symptoms of inflammation within the brain. And then I would support with omega-3. So high dose omega-3 is where I would start, but also that anti-inflammatory diet. And again, looking at the gut, looking what might be driving that inflammation and treating the root cause, but in the meantime, using an anti-inflammatory diet and omega-3s.
Perfect. Thank you so much, Dana. That was amazing. We hope we've answered everyone's questions. So thank you all for attending today. This session will be available on demand. It will be available on the website, maybe check tomorrow or the day after. You'll also get an email out after this, and that will tell you how to claim your free brain fuel supplement. So those of you that are attending live today, you do get a free brain fuel supplement to try for yourself. For those of you that are watching on demand, I apologise, it is for the in-person attendees only. The details of how to claim that will be in that email as well. And I want to mention our next webinar as well. So our next webinar is going to be the end of August, and it's going to be on children's nutrition. So we've got an expert on children's health and nutrition, so that's really exciting. So do look out for communications on there. You can register for that already. That's already live for registrations. And I also wanted to remind everyone about the Vegans Professionals website, which has a whole load of resources on there, and that's available to professionals and students. So we've just added some metabolic rate calculators, basal metabolic rate, and caloric needs, and also macronutrient needs calculators on there, which is really helpful clinical tool. So do check that out. And thank you everyone for listening again. And on one more note, if you aren't a member of the Dr. Vegan Practitioner Scheme, do sign up. It's really quite amazing. Yeah, you get so many benefits from being a practitioner. You're the first to know about upcoming webinars, and you get free products as well. So there's not much to not like. So we've got email addresses on the screen there. You've got mine, so you can email me any questions, and Dana's email address is on there as well. And Dana website, so go and check that out as well. And of course, if you do have any ADHD clients that you're really struggling with and you feel like it's a bit out of your depth, do feel free to drop Dana an email and see if she can help you with like some clients. That'd be really good. Okay, so thank you everybody. Do have a good evening, and I'll see you on the next webinar next month.
Thank you so much.
Okay, thank you.